Okay, we're going to finish up the disorders. First, we have cerebral hemorrhage. So, cerebral hemorrhage, put simply, is bleeding in the brain. Bleeding in the brain. Um, it causes huge damage to your brain tissue, and it can be caused by different things. It can be caused by arteriosclerosis, where the artery is not elastic anymore, and the blood pumps, and the artery is not elastic, and it ruptures. Or it can be caused by injury. Sometimes, if you're in an accident, there can be bleeding in your brain. And also, it can be caused by disease, certain diseases, cancer, brain tumor. Even a benign tumor can cause bleeding in your brain. But bleeding in your brain is very dangerous. Some people have a little bit of bleeding in the brain and they're okay, but sometimes it can make a huge difference. And if it damages your tissue, your brain tissue, you can have symptoms that remain that can be like a stroke, depending on where the bleed is. Peripheral vascular disease. So that has to do with the arteries being blocked. This usually happens in the leg, where you get no arterial blood to, or very little to your leg, right? And if you're not getting arterial blood to your leg, your foot, uh, you can get gangrene, right? Because it's very painful. There can be numbness and tingling that starts. Some people also feel like their foot got very, very hot, and that's how they knew there was something wrong. We talked about varicose veins already. Hypertension, that's high blood pressure. Okay, many different things can cause it. Normally, it's because you can be overweight. It could be diabetes. It could be aortic stenosis. So, high blood pressure can damage your organs. It's a silent killer, and it can lead to stroke, heart attacks, kidney failures, because especially in your kidneys, your blood is already under higher pressure in your kidneys, and it can't take the injury. Um, it's mostly diagnosed during routine physicals. So you go to your doctor and they slap a cuff on you and they're like, wow, your blood pressure's high. So normal is 120 over 80. Pre-hypertension is 120 to 139 over 80 to 89. Stage 1 hypertension would be 140 to 159 over 90 to 99. Stage 2 is 160 plus over 100 plus. 1 in 3 Americans have hypertension. People who are at higher risk are postmenopausal women and Black Americans. Risk factors. So here's some of the risk factors: stress, smoking, overweight, a diet high in fat, and family history. Because remember, if you're eating a diet high in fat, you're getting cholesterol deposited into your arteries. That narrows them. That increases your blood pressure. The best thing to do is relaxation if you're experiencing stress, sometimes meditation. Reduce the fat in your diet, exercise, lose weight, and sometimes medication. Now, white coat hypertension is when people um, get nervous. They go to see a medical professional and they get nervous, they get stressed, and their blood pressure is higher. So it's the best thing to do is if your blood pressure is always high when you go to the doctor, it's good to get a cuff and just take it at home when you're comfortable. You should take it at the same time every day, usually in the morning, and you keep track of your blood pressure. So when you go back to the doctor and you get that high blood pressure, you can take out the chart and say, here's what my blood pressure is at home. Hypotension is the absolute um, opposite. So low blood pressure would be 90 over 60. Chronic low blood pressure is usually not problematic, but sometimes it can drop and you get dizziness, syncope, which is fainting. And then you can have orthostatic hypotension, is when you get low blood pressure when you stand up. So what we usually do at the hospital, when the doctor suspects orthostatic hypotension, we take the person's blood pressure laying down, then we wait, and then we take the person's blood pressure sitting up, and then we wait, and then we have them stand up and we take it when they're standing up. And if we see it dropping, then we know that they have orthostatic hypotension. And sometimes we have it anyway. Sometimes if we get up too fast, we get a little bit dizzy, like, whoa, got up a little too fast. That's orthostatic hypotension. Sometimes I have an older sister who would get get syncope whenever we went to church in the morning, because you can't eat before you go to church, and she would just faint. I think it happened like 2 or 3 times. Um, we've already talked about transient ischemic attacks, and that's just interruptions, temporary interruptions of blood flow to your brain. Um, Sometimes that's caused by a narrowing of your carotid artery due to fat accumulation. And what can happen is not enough blood is getting to your brain, or sometimes little tiny, tiny, tiny pieces of whatever's in your artery gets broken off and goes to your brain. These can cause stroke-like symptoms. So, stroke-like symptoms are the same things you would see with a stroke, except they're temporary. Drooping, weakness on one side, slurred speech, dizziness. It mostly disappears within an hour, but you should never ignore it. 1/3 of people who have TIAs have a stroke in the future. And we talked a little bit about that when they thought that I had a stroke or a TIA. I was very upset about it because I thought, now I'm at risk for stroke. And then they figured out it wasn't a TIA, but you can't ignore a TIA. It's a very dangerous thing to do. The next is cerebrovascular accident. So that cerebrovascular accident is a sudden interruption of blood flow, blood supply to the brain. It's a loss of oxygen to your brain cells and results in brain tissue death. It is the third leading cause of death in America. Things that can cause a stroke: smoking, hypertension, heart disease, family history. Ischemic strokes are mostly caused by a fat deposit in the artery. A clot that's stuck in the artery breaks loose and travels to your brain. And when it does that, it causes a stroke because once that clot blocks off an artery, now you have a place in the brain that's not getting any oxygen. Hemorrhagic strokes are ruptured blood vessels. So if you're having hypertension and you're not treating it, you're not paying attention to it, those fine little arteries in your brain, if one of them ruptures from the pressure, now you have a stroke, a hemorrhagic stroke. So the signs and symptoms depend on the location of the accident. So on the right side, it affects your spatial and perceptual abilities, and your hemiplegia, which is paralysis, is to the left side of the body. So the right controls the left and the left controls the right. If it is the left cerebrum, you have aphasia, which is loss of speech and memory. So remember, if a stroke is on the left, it's going to affect the right side of your brain. So you're going to have aphasia. You can have dysphagia, which is the ability to say what you want. You can have right side hemiplegia. You can have emotional lability. And we kind of talk a little bit about this, where elderly people often have a little emotional lability. They kind of think it's kind of like they lose their filter. Uncontrolled, unexplained displays of crying or anger or laughter. They can have depression, coma. Strokes can cause coma, and they can also cause death. So the best thing to do is know what to do. And here's what you do. It's called FAST: face, arms, speech, time. So you look at their face, they smile, look for facial droop. Arms, have the person raise their arm, and one arm will come up and the other one won't. Speech, have the person repeat sentences and look for slurred speech. And time, be sure you look at the time of symptoms onset. You don't want to wait if somebody's having a stroke. You have to get them in the first hour treatment for them, or else it goes out of control and it's too late. Most symptoms, if you get them into a hospital within 4 hours of the signs and symptoms, that's the most effective treatment, when you can treat them the most effectively. A CAT scan to predetermine presences of clot or bleeding. If it's a clot, they're going to give you what's called TPA. It's a clot buster. It dissolves the clot and restores flow. After a stroke, people go into rehab. Physical therapy, relearning self-care, addressing changes in cognitive skills, memory loss, problem solving, communication and social interaction. Sadly, a lot of people who have strokes do end up in a nursing home because they're no longer able to care for themselves. And that year after the stroke is when they get most of their ability back. If they don't get the ability back in the first year, it really doesn't come back. It might come back a little, but you really got to work on it the first year. Prevention is key. So heed warnings from a TIA, don't ignore them. Reduce your risk factors, quit smoking, reduce hypertension, exercise, go to the doctor. Okay, I'm going to stop there. I went a little bit over, but that's okay. I'll come back with the last part of lesson 3.